It's really unfortunate that, that the market has changed because of a small number of individuals who complain. That has happened in terms of the complaints in the United States. We have never actually seen a change in our market because of that. You know, patients certainly can have complications after refractive surgery. It is surgery. It is, however, the most safe and effective surgery of any type that we have worldwide. And the vast, vast majority of people are able to see very well without any glasses or contacts. One thing that's lost in this all the time is actually the risk of glasses and contacts. It seems logical, but people who don't need glasses or contacts probably shouldn't be having surgery. People who do need glasses or contacts, if the glasses are lost or broken at the wrong time, it can be catastrophic. Your contact lenses can cause infections that can cause you to lose the eye, as well as a corneal transplant or something else. So there is no perfectly safe option for seeing well. Refractive surgery is as safe, if not safer, than every other option available, and it's unfortunate that patients get swayed by a very small number of people who have had complications.
No surgery is risk-free, but of the surgeries available today, this is considered to be one of the most safe elective procedures available. So I would be, again, caution the public with where they're getting their information, and they should reference the peer-reviewed literature. This is a very safe procedure, and we know this by studies done by the American Society of Cataract and Refractive Surgery that looked at the safety profile in LASIK, and it's excellent.
Compared to other procedures in medicine, is still one of the safest procedures in the world with the best rates of success. So this is the most important thing. So to me, LASIK procedure is really safe. Obviously, we have to pay attention in the preoperative time to very important risk factors, and during the surgery we need to use the best technology available to avoid some problems that we can avoid right now. But with all that being said, again, LASIK surgery is a very, very, very safe procedure.
Unfortunately, around the world, there's been a lot of bad publicity around refractive surgery. Now, as a scientist, the bad publicity is generated essentially by the media and ignores the total numbers of throughput. For example, in my own country, there's around a 95 to 97% success rate. Now, these people that fall within that successful group are rarely seen on television or in the media. But the remaining 3, 4, 5% have a huge amount of coverage. And that generates a completely biased view, which unfortunately puts a lot of people off going further. But if people actually do the research and look at the true numbers, the number of complications are tiny. Some individuals have undesirable effects which we know about and can be remedied. The number of complications that are really serious complications are tiny, and they're tiny throughout the world. So I have been really puzzled to see why the effect of a small minority, a tiny minority, has had such a dramatic effect on the situation in Japan.
The comments by the Japanese agency really don't make any sense to me, quite honestly. So I don't know where they're getting a 40% risk of complication from. LASIK is one of the most safely performed procedures in the world. And it also has an exceptionally high rate of patient satisfaction, not just in Japan, but everywhere else that it is done. Now, having said that, It also has to be done by surgeons who are well experienced and who really do know what they're doing. And I find it quite odd and completely just out of the ordinary that these statements and statistics would be quoted as a risk to the general populace.
It's been, frankly, dismaying to hear about the massive onslaught of negative publicity about LASIK generated by a small number of complaints. There is no question it is a surgical procedure, and you cannot do anything to the human body that is risk-free. And we all accept that, and I think that the past 2 decades of refractive surgery have been most notable for a very serious and sincere effort by ophthalmologists to improve the procedure and reduce complications. If you look at the statistics about the complications, well, there's one thing that's stunning. It's less, significantly less, than contact lenses. And this has been completely ignored, I think much to the detriment of the overall safety of the public. And I don't know exactly why it's so interesting to the press or to government agencies to respond to a very small level of problems and blow them completely out of proportion, as opposed to taking the approach that we've all been trained to do, which is to take the approach of evidence-based medicine, where you look at the evidence and you approach it in a scientific way and work towards solving problems and avoiding problems.
So if you talk of complications, yes, it may occur, but the percentage is minuscule. Second issue is, if the numbers are coming down, I would say it's an economical reason. It cannot be a surgical related problem. Because from a surgical point of view, when you have such top-class machines, because the industry is pumping in a lot of billions of dollars into this field to make the best and best and best machines, always. So obviously, there's no fault in the technology and there's no fault in the surgeons, because the surgeons are again top class.
It's crazy that we keep with this discussion. LASIK has shown that it's a very safe and effective procedure. It's probably the safest procedure in the world and the most performed in the world in volume. And of course, there are good patients and bad patients. If the surgery is performed in good patients, everything is fine. You won't have any side effect. The problem is improving in diagnostics and picking the right patients and not forcing overcorrections in patients that should have a different procedure.
I am considered as an expert in complications. I have been since the very beginning of refractive surgery, practicing initially RK and then PRK and then LASIK. I have practiced all the technologies, and believe me, this is one of the safest procedures you can take in the human surgery. It's not only the safest, it's indeed the most successful, but this is medicine. Medicine has some complications. Complications might happen by chance, might happen because of bad luck, sometimes because inadequate judgment of the doctor, and sometimes because the patients are over-responding to problems.
I'm surprised to see the Japanese community with all this technology available all around. I've been using a Japanese laser for 20 years now, and I'm surprised that this is happening in Japan, where you have the best technology and the best surgeons also. So this information is really surprising to me, and I would say maybe this is the wave and it will pass, and because LASIK is one of the most successful procedures that have been done in surgery, not only in ophthalmology, and I'll be very happy to see the refractive surgery volumes coming back to what it was before, because this is the way we ophthalmologists are helping people to improve their quality of life.
We've been seeing LASIK patients for almost 15 years now, and we find that complications resulting from well-performed LASIK or refractive surgeries are very, very minimal and rare. I can only think maybe of 1 or 2 patients in my practice that have had problems. And overall, I would recommend this to my own relatives to undergo LASIK surgery if they're qualified.
I would hate to see, based on sort of the highlighting some unhappy patients or patients that had complications, sort of an over-dramatization and exaggeration of the risk. The data on LASIK is very clear. Again, when it's done for appropriately screened candidates, the risk is actually very low. And I think you can look at, there's a recent study in the Journal of Cataract and Refractive Surgery looking at LASIK performed on ophthalmologists and their families. And I think it's hard to show any more confidence in the safety and reliability of the procedure than to actually have it done on yourself or your own family.
Some of the more significant complications that have been historically known or that might occur with LASIK are very small percentages. LASIK really is considered a safe procedure. If you consider that it's the most frequently performed elective procedure in the whole world, that says a lot. Why would this be something to stop if there's more patients having LASIK than any other elective procedure, including other aspects of medicine? This is the most frequently performed, and it can only be that if it's a safe procedure.